I'd like to welcome you to another episode of Coffee Kids and Sports Medicine, where I have the privilege to introduce two of my colleagues here at the Scottish Rite Sports Medicine Center, Dr. Jane Chung and Taylor Morrison. Dr. Jane Chung is a sports medicine pediatrician who joined us about 4 or 5 years ago. She is originally from California, did her medical school training at LSU in Louisiana, followed by her pediatric sports medicine training at Case at Rainbow Babies in Cleveland. Since she's joined our practice, she's had a particular interest in the female athlete and has been speaking nationally on some of her research, most recently at the AAP, looking at mental health screening tools in our youth athletes here in our clinic. She is joined today by Taylor Morrison, who is a certified sports dietitian. She has been treating our young athletes in terms of trying to counsel them on taking the right fuel before they play a game or even before a season to get through the season. If you want to follow on Instagram, she's got great tips and tools for you to fuel your young athlete on her page on Instagram. So I'd like to give the podium to Dr. Chung and Taylor. They're going to talk today about body, mind, and sport.
Good morning, everybody. Thank you very much for the kind introduction, Dr. Ellis. Taylor and I are very excited to be with you guys here this morning. We have no financial disclosures. So this morning we're going to talk about wellness and keeping our young student athletes healthy and well. As you can imagine, there are many components that go into keeping our athletes healthy and well. Some of the specific components that we'd like to discuss this morning are load, nutrition, sleep, and mental health, and how they all work together to keep our young athletes healthy and well. These are the objectives we'll go over. First of all, we will discuss some of the definitions of what load is, overload, and recovery, and how we can help our athletes find the right balance. We'll also talk about the important role of nutrition and overall wellness in our young athletes, as well as the important role of sleep in recovery and injury prevention. And lastly, we'll also talk about how we can help our athletes manage stress and address some of the mental health issues that they may face. This is a diagram that shows those 4 components and how each of these are interrelated. There is a fine balance between each of these components. So if one component is off balance, then it can negatively impact the other components as well and lead to a more prolonged recovery, increased risk of injury. So what is load? There are 2 types of load, external load and internal load. External load may be sport specific due to the demands of the sport, but essentially it's the work that's completed by the athlete during their training and competition. For instance, it may be the number of pitches thrown, the miles ran, the hours of training, or the amount of weight that's lifted, and it creates physical, physiological, and psychosocial demands on the body. Internal load, I like to look at it as the body's response to external load. And it's the individual physical, physiological, and psychosocial characteristics that respond to the external load, whether it's the amount of muscle that's gained or sense of self-satisfaction, sense of accomplishment. And if these are done properly and safely, it can help improve an athlete's performance and reduce the risk of injury and illness. This is a table showing some of the examples of external and internal load. So for instance, some of the physical external loads may be jumping, running, throwing, or pitches thrown. Some of the physical aspects of internal load, which is the body's response to the external load, may be increased range of motion, increase in skill mechanics, muscle strength and gain. Now let's talk about overload. What is overload? So when load is not managed well, or if it is too excessive, then it can lead to overload. And this has negative implications and can manifest in altered performance, increased risk for injury and illness. And it's really important that we are able to modify and to identify load and help minimize overload so that it does not negatively impact the athlete's performance. What is recovery? So this is the period and process which during the body responds to load. Adequate recovery is what all athletes should strive for, and these are the positive adaptations for athletic capacity, performance, and injury and risk. Inadequate recovery are the negative adaptations for athletic capacity, performance and injury and illness. And this table gives some examples of recovery and how it optimizes adaptation to the internal and external loads. So from the physical aspect, it will provide joint stability. If there's adequate recovery, it gives the body time to allow for tissue healing, improving range of motion, flexibility, improving strength. From a physiologic aspect, it will improve immune system, nutritional status, and from a psychosocial standpoint, it can optimize sleep quality, improve mood. And so it's all about striking the right balance. But what happens when there is too much load, too intense training, or increased training for athletes not properly conditioned for increased load? Well, this is what can happen. So in this diagram at the top, we see there's a perfect balance between load and recovery. And when there is this optimal balance, it can lead to health and performance benefits in our young student athletes. However, if the seesaw is tipped over and there is more load and not enough recovery, which we call overload, then we can see this imbalance and negative effects on health and declined performance. Some of the medical issues that we see with overload and overtraining can include sleep disturbance in our young athletes, dysfunction in their immune system where there is elevated lactate, ammonia levels, CK levels, urea levels, toxins that can lead to prolonged and delayed recovery. From a cardiovascular standpoint, it can decrease the athlete's ability to achieve maximal heart rate. From a respiratory standpoint, overtraining athletes have been found to have lower respiratory exchange ratio and decreased VO2 max, which is the amount of oxygen that the athlete consumes during intense training. From a hormonal standpoint, if there is overload, the athlete may experience negative balances, specifically in female athletes where the gonadotropin pituitary axis receives a negative feedback and the hormones needed to allow for normal cycles may be inhibited and can lead to negative repercussions such as the female athlete triad, which we will discuss later. And from a nutrition standpoint, it can lead to low energy availability, suboptimal nutrition, underfueling, allowing them to be more prone to have overuse injuries and more prolonged recovery. So overtraining is a form of overload, and it oftentimes leads to a plateau in an athlete's performance, where they feel like they may be training just as hard but not seeing the benefits with the usual rest and recovery cycle. These symptoms are oftentimes highly specific, and they can manifest as both physical and psychosocial symptoms, such as weight loss, decreased appetite, some GI issues such as diarrhea, loose stools, elevated fatigue levels, delayed recovery, decrease in their immune system, increased risk for overuse injuries, poor sleep, and elevated heart rate. Some of the musculoskeletal issues related to overload and overtraining are as follows. And these oftentimes occur when the athlete's body is not prepared to meet the stress and the demands that the muscle, tendon, bone unit exerts during training and competition. And so frequently we will see injuries that include bone stress injuries, such as stress fractures, which are overuse related injuries. For instance, when there is a sudden change or increase in load and overload, it puts the athlete at an increased risk for having bone injuries such as stress fractures in our runners. Young athletes are specifically vulnerable to having growth plate injuries in those skeletally immature athletes. So growth plate injuries in the shoulder, ankles can be seen, muscle injuries, tendon injuries. These are all overuse and overload related injuries from a muscle bone standpoint that we frequently see in our young athletes when there is overtraining or a sudden change in load with a body not being adequately prepared to meet the demands.
Now I'm going to talk about one of the second components of wellness in the young athlete, and that is nutrition. So ideally, we would love for our athletes to have optimal load, optimal nutrition, but when they start to experience suboptimal nutrition or inadequate nutrition, then their wellness can really start to decline. And so what I've got here on this slide is what it looks like when an athlete is experiencing optimal nutrition, getting enough of what they need, and what an athlete experiences when he or she is experiencing suboptimal nutrition. And I do like to remind athletes and parents that an athlete may have a great intake, may be getting adequate nutrition, but then something changes in his or her physical activity, and maybe training increases, or they start another sport on top of a sport that they were already participating in, and suddenly they are now getting suboptimal nutrition. And so it's really important to keep in mind how much activity your athlete's doing and make sure that your nutrition goes along with that. So again, this slide gives examples of what you may see in an athlete with optimal nutrition and an athlete experiencing suboptimal nutrition. So in the first case, we've got decreased injury and risk of injury, increased bone strength, increased lean muscle, decreased time away from sport, and improved mood. Now, when the athlete experiences suboptimal nutrition and overload, we can see hormone changes, altered menstrual cycle in our female athletes, increased injury, and they're going to have an increased risk of injury, decreased response to their training, delayed healing, increased illness, mood changes. You may see some depression or more frustration. Mood changes can vary. You might see your athlete more tired, experiencing a lot more fatigue, and in some cases, the athlete may experience disordered eating. But I want to talk quickly about what do I mean when I say optimal nutrition? How can we gauge if our athletes are getting the nutrition they need to support their sport, their activity, and their growth and development? When I say optimal nutrition, I'm talking about adequate energy availability. They're getting a variety of foods from a variety of food groups, meal and snack timing, hydration, and what I like to call food talk. So adequate energy availability. This means that the athlete is getting enough calories to support their training and growth and development. This is referring to total energy calories in. We want to make sure that overall the athlete is getting enough at the end of the day. Then, second, we want to talk about getting a variety of foods from a variety of food groups. So this is, what are those calories made up of? And we want to make sure that our athletes are getting all the macronutrients, so they're getting carbohydrates, they're getting protein, they're getting fat, and we want to make sure that they're getting different forms of carbohydrate. They're getting different types of protein, they're getting different types of fat, because each of these macronutrients do something different to fuel the athlete. We know carbohydrates are the best source of fuel for the athlete's muscles and for the brain. So school, for mental acuity, to be sharp, and to take tests and learn. Protein, of course, build and maintaining muscle and provide structure for tendons and bones. And I always remind athletes that they also need fat daily in their diet as well. Fat is another source of fuel for the athlete. It helps absorb those great vitamins A, D, E, and K that we find in a lot of our colorful fruits and vegetables and foods like that. And then those healthy fats help our bodies fight inflammation, which is really important after a really long or intense training. Now, I like to remind athletes that it's really important that we don't just focus on these macronutrients, the carbohydrates, the protein, and the fat. Because if we do that, then we can have athletes relying on protein powders and energy bars, and then they're missing out on a lot of these micronutrients that are just as important to the overall health and well-being of the athlete. And on this slide, I have a handful of important micronutrients for the athlete, and I've given you some sources of the nutrient and then what it does for the body. So of course, iron is important, zinc, calcium and vitamin D, extremely important for these growing athletes. The omega-3s and then antioxidants like vitamin A, vitamin C, and vitamin E. And so we want to make sure, like I said, that the athlete is getting a variety of foods from a variety of food groups, because that ensures that they're getting different macronutrients, like we talked about on the previous slide, and they're also getting a variety of these micronutrients to ensure optimal performance, but also decreased risk of injury and overall good health and wellness, optimal growth and development. Now, just as important as what the athlete eats is when the athlete eats. And so that is the next component I've outlined here for optimal nutrition. So athletes need 3 meals a day and typically at least 2 to 3 snacks. Of course, that varies with the athlete, body size, body type, age, the sport that he or she is playing, but typically all athletes need their 3 meals, and then they need at least 2 to 3 snacks. And I typically say a meal, if you can get 3 different food groups out of the 6 at least, that's a good rule of thumb. Snack-wise, if you can get at least 2 different food groups out of the 6, that's a pretty good snack right there. The exception is if that snack is right before a game or a practice. So if that snack is for kind of a performance snack, then really we're focusing on athletes' acceptance of the food and digestibility. So that athlete needs to make sure that it's something that they tolerate well and provides adequate energy for their performance. And so just making sure that they're getting their meals, no skipping, and they're timing their snacks well. A lot of times, to help an athlete understand that, I'll give an example. For instance, protein. The body needs a certain amount of protein at the end of the day, depending on the athlete, but the body can't get all of that protein in one meal. It can't, or that protein can't be utilized efficiently by the body. So it really needs to break up the protein in smaller amounts at breakfast, lunch, and dinner to be best used by the muscle and the body for injury prevention and recovery. Same thing goes with nutrients like calcium. The body really needs to break up the calcium during the day instead of trying to get all the daily needs of calcium at once for optimal absorption and use by the body. Now, the fourth component of optimal nutrition is hydration. I always tell my athletes, don't wait to hydrate. You can't make up for lost hydration or lack of fluid right before a game or a practice. It's just not going to help the athlete like it would if they started drinking fluids in the morning the day before and consistently was drinking fluids throughout the day. These are guidelines right here of a drinking protocol before, during, and after an event. If the athlete still has trouble staying hydrated, you notice some nausea, fatigue, trouble concentrating, different symptoms of dehydration, it would be great to get with a registered dietitian or sports medicine team and come up with a hydration plan for the athlete. This could be especially important during the really hot summer months when the athlete's losing a lot of sweat and could be losing a lot of sodium in the sweat as well. It's colder right now, and so we need to remind our athletes that while it's cold, getting enough fluids is still really important. We may not feel as thirsty because we're not as hot, but it's still important to bring a water bottle to school. Maybe it's room temp water, or including maybe soups with lunch, or having a hot chocolate made with milk as a recovery drink. Those are all great ways to contribute to the hydration of the athlete during these colder months. And the last component of optimal nutrition is what I call food talk. And this is the way food and nutrition is discussed. We want to promote a healthy attitude around food and a body positive environment, especially important for the aesthetic and the lean sports. Just want to make sure that success in the sport is measured by performance and health. And so I'm going to turn it over to Dr. Chung.
So this is a diagram showing the spectrum of the female athlete triad. And as you can see at the far right end with the green triangle, the athlete has optimal energy availability, optimal bone health, and are having normal, regular menstrual cycles. And then at the far left end with the red triangle, you see an athlete with low energy availability, either with or without an eating disorder, low bone mineral density, which can also lead to osteoporosis later on, and dysfunctional menstrual periods, oftentimes due to functional hypothalamic amenorrhea, all due to low energy availability. And so there is a wide spectrum in which the female athlete can fall in between. Obviously, we would optimally like all our female athletes to be in the green triangle zone. However, we do see athletes in the middle and in the red triangle zone. And so these are the athletes that we want to keep a close eye on. So who is at risk for the female athlete triad? Oftentimes, it's our athletes who participate in sports that emphasize leanness and aesthetics, such as our gymnasts, our cheerleaders, our figure skaters, our dancers. Also, those athletes who participate in weight-specific sports, such as our boxers, our rowers, specifically the coxswains, wrestlers, and those athletes in gravitational sports, such as pole vaulters, or endurance athletes, such as our cross-country runners, cyclers, equestrian riders. And so why do we care so much about the female athlete triad? Well, some of these consequences can be irreversible. And so let's talk about some of the consequences of low energy availability. Because remember I said the root cause of the female athlete triad is due to low energy availability, underfueling, and suboptimal energy that the body has, where they're expending a lot more calories than they are consuming. And so after they expend all their calories through exercise and through physical activity, the body is in a negative balance, so they don't have enough energy to carry out calories and energy needed for normal development and growth for a healthy young athlete. And so from a bone health standpoint, low energy availability can negatively affect bone health, lead them to having low bone mineral density, or even osteoporosis later on in life. It can negatively affect the reproductive system in females by causing menstrual dysfunction, where if there isn't enough energy, the body doesn't get a signal to the brain, so it will not release the hormones that are needed to have normal menstrual cycles. So estrogen and progesterone will not be released normally. And specifically, estrogen is very important for maintaining bone health in young female athletes, and it stimulates bone growth and recovery. From a cardiovascular health standpoint, there have been several studies looking at endurance athletes and dancers that have alluded that those female athletes who have menstrual dysfunction or are not cycling normally are associated with having an increased risk of coronary artery disease and endothelial dysfunction in the heart compared to the normal cycling females. And performance will also be negatively affected with decreased performance, increased fatigue, increased risk of injuries and bone stress injuries such as stress fractures and stress reactions. And they may feel like they're training just as hard, but not seeing the improvements and the benefits. Similarly, there is something called the male athlete triad, which is beginning to shed more light on, and it's kind of a parallel to the female athlete triad, where the root cause is due to low energy availability, underfueling, and energy deficiency. These male athletes will also see impaired bone health. And in terms of the reproductive system, they will see suppression in the reproductive system as well, with low testosterone, decreased libido, and oligospermia. There's this concept called RED-S, known as relative energy deficiency in sport, that was first introduced by the International Olympic Committee in 2014. And this is a theory that pretty much says, that low energy availability can cause impairments beyond the triad of bone health, menstrual function, and low energy availability, and that it can cause impairments beyond, including the endocrine function, metabolic system, cardiovascular, immunological, and the GI system. And so there's still more research that needs to be done regarding this. This is a great resource for physicians and for healthcare providers taking care of young athletes. It's the Female and Male Athlete Triad Coalition, and it has great educational resources, handouts for parents, coaches, and young athletes, and I encourage you to check it out. Another component that is very important in helping maintain health and wellness in our student athletes is sleep. So sleep, we all know, is very important for physical, mental, and cognitive well-being. It's so important that the NCAA has also named sleep and nutrition, along with performance, one of its top 3 priorities for health and safety in their young collegiate athletes. It plays a crucial role in academic and athletic performance, injury, and recovery. There are some papers that have come out to show that those young athletes who get less than an average of 8 hours of sleep a night are about 1.7 times likelihood of getting an injury compared to those young athletes who get at least 8 or more hours of average nights of sleep per night. And that study came out in Boston. In terms of recovery from a sport-related concussion, our group here at Scottish Rite recently showed and published a paper that showed that those athletes who have good quality sleep are likely to recover faster and have less symptom severity following a sport-related concussion than those athletes who had poor quality sleep. And so truly, sleep does play a very, very, very important role in overall recovery, injury prevention, along with mental acuity and focus needed for academic performance as well. So when we break it down and look at good sleep quality and those athletes who train with a balance of good load, these athletes are getting at least 8 to 10 hours of sleep a night, no issues falling asleep or staying asleep, and they're able to focus and concentrate during the day, whether it's in the academic setting or in the athletic setting on the field. Poor quality sleep is often associated with overload and those athletes who are overtraining and not getting adequate sleep. These athletes are tending to get less than 7 hours of sleep a night. They're frequently getting poor quality sleep where they're waking up in the middle of the night or having a really hard time falling asleep. Sometimes they're needing medication to help them fall asleep, and they're unable to stay awake during the day, whether it's in the classroom or on the field or court. So some of the poor signs of sleep quality: decreased athletic performance, recovery time is prolonged or delayed, they will have decreased reaction time, processing speed, cognitive aspects are impaired. It can also affect their mood. A lot of the times these athletes are grumpy or really tired and fatigued. And this puts them at an increased risk for injury if they are not reacting as fast. Their processing speed and their reaction time, all of those can be negatively affected by inadequate sleep quality.
And the final component that we are going to talk about this morning when it comes to the wellness of the young athlete is mental health. And this is an issue or concern that has really come to light recently as more collegiate and professional athletes have openly started talking about their struggles with mental health concerns. And so this first video we're going to play for you is a TED Talk by a USC volleyball player, and she is talking about the stresses and the load and overload she experienced as a collegiate volleyball player.
You have to be at a team lift at 6 a.m., but you're accidentally 1 minute late because you slept through your alarm. Your heart's pounding from sprinting to the gym, but nobody cares that it's because you were up until 2 a.m. studying for an exam that you still don't feel prepared for. You can feel the tension between you and your teammates who now have to run sprints tomorrow at 6 a.m. because you were 1 minute late. You start the lift, and your mind's just not in the right place, but it doesn't matter. You have to lift. And as soon as it's over, you scarf down breakfast on your way to 8 a.m. class, and you get there, and your hair's still wet because you didn't have time to dry it. The professor looks at you and says, "Where's the homework assignment?" But you forgot it. How could you forget it? You were supposed to be on top of everything, so you sit there and you worry about what else you might have forgot. And at noon, you get a 30-minute break, but it's not really a break because you use it to quickly make up an assignment you missed for last week's game. And soon, it's 12:10, and to you, 40 minutes does not feel like enough time to get on the court and be ready, even though it actually is. So you head over, and at 1, practice is starting. And you have to forget everything that happened in your day, because at practice, you have to perform. You can't not perform. There's someone better than you, someone competing with you, and someone in high school who just committed to be you. So forget the 0 on your assignment. Forget the test you're not prepared for. Forget the friends you haven't seen in weeks. Forget the argument you've been in with your parent. Play well, pass well, perform. And when it's finally over, you find yourself staring in the locker room mirror, trying not to cry. And you ask yourself, is this how I'm supposed to feel?
So mental health is the final component, as Taylor mentioned, that we would like to discuss in keeping our young student athletes healthy and well. And so it truly is the injury you can't see. It's not a broken bone, it's not a swollen knee. This is a component that we don't physically see. Some of the mental stats that I'd like to go over: 1 in 5 youth meet the criteria for a mental health disorder. These injuries can have psychosocial consequences as well as physical, including mood swings, depression, and disconnection from their peers and their family. Decreased flexibility, coordination, and balance can accompany adolescence and contribute just to the overall stress and anxiety in which our young student athletes face in today's day and age. Stressors from coaches or parents, or stressors that they put upon themselves to perform and to do well, not only on the field, but academically as well too. Athletic trainers in particularly play a very special and important role because they spend the most time with our young student athletes at school. And while they are not in charge of diagnosing mental health illnesses, if they do recognize it, it is important that they get with a school nurse or a counselor to help the athlete get referred to a mental health professional.
And so now I want to go over mental health, looking at a state of load and a state of overload. Our athletes that have appropriate load will have a healthy sense of well-being. They will be getting quality sleep, and they should be seeing optimal recovery and recovery time. Our athletes experiencing overload when it comes to mental health will see slowed reaction times, decreased speed and agility. They can have decreased concentration. We'll see changes in their mood. They may start to experience disordered eating, or some may develop a clinically diagnosed eating disorder. They'll see sleep disturbances, actually a decrease in lean muscle, or they'll actually have a difficulty gaining lean muscle. So if you've been working with an athlete to build lean muscle and you're not seeing the improvements and advancements that you expect, this is something to consider, especially if they're exhibiting any of these other symptoms. They also may start to have decreased academic performance and struggles with different relationships. And next we're going to show you one more video. This is the trailer for a documentary that came out this summer, and it talks about the mental health of Olympic athletes. And while this is focused on Olympic athletes, we really can't brush this off as just Olympians. These are things that some of our young athletes may also be experiencing, especially our very elite athletes or athletes doing multiple sports, very serious about it. These are things that they can be experiencing when they're away from their sport due to injury. It could be weeks, months, or up to a year, or during times right now where their season potentially is canceled. And we have to realize and consider that this could be very, really mentally tough for our young athletes that we work with. And so we will play this trailer for you.
Of post-Olympic depression.
It's gold, and then what?
I didn't develop outside interests.
I thought of myself as just a swimmer and not a human being. That's where I was just like, why don't I just end it all?
From the outside, it's like you got everything.
Athletes just don't talk about our weaknesses. That just cracks the facade.
Mainstream media love building somebody up and then come crashing down.
Depression puts you into a spiral. You start getting deeper and deeper into it.
He was my best friend.
We have to do something. And this is important.
Youth around the world watch and look up to these people.
I've given my blood, sweat, and tears. And all I'm asking is that someone can help me get through this.
We're human. I don't think I have to say anything else.
So this is a consensus statement that was put out in 2015 by the National Athletic Trainers Association, giving recommendations for developing a plan to recognize and refer student athletes with psychological concerns at the secondary school level. And so it's really well written. And again, it's not the athletic trainers or the coaches to diagnose a young student athlete with a mental health disorder, but if there are concerns or red flags that they see, again, athletic trainers are the ones that spend the most time with our student athletes day in and day out in the training room, on the field, practices. And so it just gives them a plan to recognize and when to refer and get the school nurses and the counselors involved. So what are some of the take-home points? Mental health should take a priority along with physical health. Oftentimes, as healthcare providers who take care of young athletes, the athletes come in for physical injuries. But it's always important that we also don't forget about the mental health aspect of it. One example is an athlete who has an ACL injury and they end up having depression because of prolonged recovery. And so it exemplifies the interrelationship and how physical health can affect mental health. And so we always want to listen to our athletes without judgment, open ears. We want to question and remind our young student athletes effective ways to cope with stress and difficulties. And oftentimes we can share our own experiences, initiate formal conversations about coping, get our sports psychologists or counselors involved. Early identification and action is really important. As we had been pointing out, this is an injury that we cannot physically see. And so sometimes, if you wait too long, it can be to a point where it is more serious than what we would like. And so we want to identify these athletes early, get them the support and the help that they may need. Because again, it's not just the physical aspect of it that we take care of our young athletes, it's the whole athlete in which mental health is important to the athlete's well-being. These are some resources that we have listed here for our young student athletes and for the coaches, athletic trainers to look at.
Our take-home points for nutrition. To optimize nutrition, we need to make sure our athletes are getting 3 meals a day, plus snacks as needed, typically at least 2 to 3. Again, depends on the athlete. 3 out of the 5 food groups per meal, at least 3, is a really good rule of thumb. And again, typically 2 out of the 2 different food groups per snack, unless that snack is right before an event or during an event for a quick source of fuel. In that case, we're focused on acceptance and digestibility of the food chosen. We want to encourage fluids throughout the day and around during games and practices. Remember, don't wait to hydrate. You want to be hydrating when you wake up in the morning, the day before. Drink plenty of fluids. Follow your own individualized hydration plan if that's needed. And remember that we can get fluid from foods like fruits and vegetables. Yogurts have a high water content, soups, things like that, as well as just water. We want to have that positive food and body talk, just a positive association with food as a form of fuel for our athletes. And I always remind athletes and families and coaches and teams that if a food group does need to be eliminated for a food allergy or another reason, then you want to make sure to seek guidance to ensure that the athlete's nutrition needs are still met. Improving sleep is our next take-home point. And to improve sleep for athletes, let's remember they want to have 8 to 10 hours of sleep a night for teenagers. We want to establish a consistent sleep schedule, and if possible, this could carry over even into the weekends. Consistent bedtime and wake times. Setting a nighttime routine is extremely beneficial, triggering the mind, triggering the brain that it's time to go to bed and start to power down. Things to trigger the brain that it's bedtime could be reading a book, taking a bath, some form of meditation, but we want this to be about 30 to 60 minutes before bedtime. Set a good sleep environment. Remember, we want it quiet, cool, dark, comfortable, and calming. Get rid of those big lights or TV screens that may be on. Make sure those are off and any kind of glow or light is powered off. With that said, no electronics 1 to 2 hours prior to bedtime is recommended. Again, that screen and the light from the screen can really stimulate the brain, making it harder to go to sleep at night. And avoiding caffeine and large meals before bed.
So we want to just tie the knot with the 4 components that we have just spoken about. So overall wellness and health in our young athlete really takes many components, specifically load, nutrition, sleep, and mental health that we talked about. If one component is off balance or needing help, then you want to make sure that all the other components are in healthy balance as well too, because if one is off balance, then it can negatively affect all the other components, throwing the overall wellness and health cycle off balance in our young athletes. And so load with overload, adequate recovery time, as we have spoken about, nutrition, as Taylor had spoken about, with adequate energy availability, timing of the meals and the snacks for optimal fueling and performance optimization in our young athletes, the importance of sleep and good sleep quality to decrease risk of injury, optimize performance, and mental health, kind of breaking the barrier, as there's a huge stigma in the media about mental health in athletes. Oftentimes is looked at as a sign of weakness. And so really encouraging our young athletes that not only physical health, but mental health is so crucial and so important in keeping our young athletes healthy and well. Because at the end of the day, our goal as healthcare providers treating young athletes is to keep them safe, healthy, well, and wanting to be active for life. These are our references. And thank you very much for joining us this morning.